How you doing, Dr. Ulysses Jackson? So today we're going to talk about how to get a clinical diagnosis. And the clinical diagnosis that I'm specifically talking about today is depression. There are different levels of depression. There are three specifically that I'm going to talk about. When people just say, hey, I'm not feeling good, I'm feeling depressed, a person could grab that and run. It's different levels of depression, from mild, moderate, and severe. So the first depression we're going to discuss real quick is that what they call MDD, Major Depressive Disorder. Get your DSM-5, get your Google, look it up. And it will show you that it has a criteria of about 2 weeks. This has been going on for 2 weeks. Not eating, not sleeping, things of that nature. So that's the first thing. So when you say you have depression, try to identify which one. So that first one is that major depressive disorder. That second one is persistent depression disorder. Now, people have the word persistent. The reason persistent is because these symptoms of depression has been going on for at least 2 years, disturbing your regular functions, such as your job, your occupation, and your social life. That this depression has been that severe. The third depression is substance-induced depression. What's that? You go out, you get a DWI, you get caught, you get arrested, your family knows. Now you're going around kind of moping all day and feeling bad and depressed because of something that happened when you were under the influence. So that would be a depression associated with substance use disorder. Another example of a substance use disorder is you high on some type of drugs, cocaine, crack, heroin. Then when you crash, the feeling of nothingness, the feeling of disappointment, the feeling that you've let people down, that can lead to depression, And then the last one is unspecified depression. What's that? You fail a test. You crash your car. You in court for child support. You in court for domestic violence. You start to be depressed. Now, we will call that unspecified until we do a thorough evaluation and find out what's making you depressed. So just saying it is different than just like, hey, I feel depressed. There's levels to this, man. It's like we run in a situation where we run into a friend and he's fixing his car. You don't become a mechanic. Or your friend, oh man, I got toothache. You don't become a dentist. So we have to stop becoming clinical psychotherapists. Study this. I happen to be in New York. Happen to be getting ready to go to a Knicks game. When I get there, I'm not going to get on the basketball court and say, give me the ball. I'm a professional NBA player. Now I'm going to sit down and I'm going to watch the game. So when somebody says, I feel this way, tell them, go seek help. We all have jobs. I can't do probably 90% of the people's jobs up here. Tech world, I don't know nothing about tech. I don't know nothing about IT. So we have to stay in our lanes, man. And that self-diagnosis, it's good to say, I Googled, I look up something, and I have these symptoms. Go find somebody that really specializes in this, because this is what's hurting a lot of us. It's just that you think you know the features of anxiety, you think you know the features of depression, and then we run with it. And then we become the best clients, our own best client, ourselves. We have to stop that. So go out and get a real clinical diagnosis and understand that when you name anxiety and you name depression, it's levels to this. It's not just one. So when you say to me, hey, doc, I'm feeling depressed. Are you manic depressed? Huh? Are you clinically depressed? Huh? Do you have major depressive disorder or is it persistent? How long has it been going on? Don't get lost with that. Dr. Ulysses Jackson, go get some professional help and get a clinical diagnosis.